Hello, everyone. Dr. Amanda here, and I am your plant-based lifestyle physician and health coach who comes to educate and empower you to make healthy decisions to live your most abundant life. Well, today we have a special guest with us, Dr. Tanielle Brew, and she is a board-certified family and obesity medicine doctor who is coming from us from Jacksonville, Florida, who has an interest in obesity medicine after she had her own weight loss journey. And she is currently developing a multidisciplinary service to assist patients with obesity and developing educational programs to increase awareness, demonstrate benefits, and provide practical tools for physicians and advanced care practitioners wanting to incorporate obesity medicine into their practice. So just listening to her bio, I thought it would be important for her to come on because what we talk about is definitely health and wellness. So I thought she'll be a wealth of information for us. So welcome to the show, Dr. Brew.
Thank you. Thank you so much for having me.
Yes, ma'am. So I gave a little bit of your bio, but I would like for you to introduce yourself to the audience. Let us know anything else you want us to know about you.
Yeah, so like you said, I'm a physician from Florida. I have my own kind of health journey, and I think we'll talk about that later, but I'll go ahead and kind of introduce it now. So initially I was doing family medicine and I loved it, but I also knew that I wanted to take it to another level because I was losing weight on my own. But I had just tried so many different things, literally, like everyone else. I tried every diet, every pill, every exercise, everything. So I'm like, you know what? I'm a doctor. Let's see if there's some other tools in my tool belt that I can use. And that's how I ended up becoming board certified in obesity medicine because I just kept researching. And then people started bringing their patients to me, and then it just grew and grew and grew. Over that, I was just able to develop just different practices and different ways of doing it to make it easier. And I realized that it's not just what you eat, it's your stress level, it's how you cope with things, it's what happens when things go wrong, how do you pick yourself back up. That is how the long-term weight loss continues.
That is so good. Yes, I talk about that a lot too. So I love it when people say things. I'm like, okay, I'm not crazy. Yeah, this is definitely how it works. So yes, so a lot of people have heard about my weight loss journey too. And so when I hear others people have that journey, I just like to dive into that a bit more. So you talked about that you had your own weight loss journey, and because you were having trouble losing weight because of all the other things that you tried, and so you looked more into obesity medicine. Before I ask about your weight loss journey though, what exactly about obesity medicine do you love, and like what geared you like more towards it? Was it just your own weight loss journey, or was it like something more? Were patients asking about it, family, anything else?
All the above. So it was my own journey. It was when my colleagues saw that my body was changing, and then when my patients saw my body was changing, then they were asking me more questions. And then my family, same. I want to be the healthiest version of myself, and I don't want to be the only healthy person. I want to be healthy.
Yes.
So all those things moved me towards learning what would be the best practices, not just for myself, but for everyone.
Yes, yes. So we can't do all these things alone, and it's always good when you hit a certain goal and other people see you doing it. Like, yes, I want to bring you along. If you're open to doing this, like, definitely I'll teach you or show you my journey. So let's then talk about your journey. So tell me what you were like before you started to lose weight, or how far back that goes when you were trying to lose your significant amount of weight, and then now after. So like take us on a timeline.
It's a long timeline.
I know.
So I was never, well, maybe when I was like 5, I was normal weight, but pretty much after that, I was always a little bit overweight. And I think my largest weight was 264 was my highest weight. And that was in grad school. And I remember I don't even remember which doctor this was I went to. And I told him, oh, I want to go into healthcare. I want to be a doctor. And he was like, you want to be a doctor, but you're unhealthy. He did not say it like that. He said it actually worse than that, but whatever. Even though the message that he said was said in an unkind way, I got the gist of it. I am going into medicine, and I do want to be an example. I don't want to walk in there and tell people, oh, well, you should do this for your health and be living an unhealthy life. So I wanted to be authentic in what I said. So that could have been a better way of phrasing it, but whatever. So that started around grad school. I said, okay, well, let me look at my nutrition. My nutrition was terrible. I literally was fast food, sodas. I rarely ate a vegetable. I mean, like, if you want to name any kind of probably generally unhealthy thing a person could do, that was me. So my first step, honestly, was like, okay, let me try to eat a vegetable a couple times a day. Yeah, like literally. So, and the only thing I really like were green beans and greens. So I said, well, let me just try incorporating green beans and greens in what I ate. And that was first step one. Because I knew at least if I did that, I was getting in some vegetables without making lots of changes. Let me just add that in. Then I knew I was drinking way too much soda than I needed to. Let me just try adding in some water. So initially, everything I did was very gentle, very, let's just see what happens when I do this. Because I knew that if I try to do too much at once, that wasn't going to end well for me. So with me, my weight loss always happened in cycles. So I would lose about 30 pounds and then I would just settle. Because a lot of times, for me, grad school, I lost about 30 pounds and I started medical school. The beginning of medical school is not the best time to be on your weight loss journey. So I decided, okay, let me just maintain. So I would go on a maintenance until things got lighter. So around second, third, and fourth year, I was able to be more judicious with what I ate. So then I add back in more of the vegetables. I was able to exercise more. I found gyms because I was like, I need to actually move my body in some way. And that's when I'm like, okay, well, I'm not going to run on the treadmill. Try that. I lasted 5 minutes. So I knew I liked to dance. So I went to Zumba classes, and that was the thing that saved me. I fell in love with Zumba. So any city I lived in, the first thing I was like, I got to find my Zumba class. So I did my Zumba class. And so that was kind of my journey. Every couple of years, I would lose about 30 pounds. And then I would take maybe a year or two to maintain. And then I got into a relationship, and like everyone who gets into a relationship, you're just so in love, and then you gain a little weight. And I looked at myself, I'm like, oh my goodness, I am getting back to the weight that was before. My weight had gone up to around like 230. And I said, you know what? Let's kick this back into high gear. So that was around 2018, 2019. That's when I really wanted to take my health to another level because I did not want to go back to where I was before. So I got a personal trainer. I really was focusing on the nutrition by then. I really kind of dived in more into the obesity medicine, and my weight really started to go down. So for me, a big thing is having a foundation. So my food foundation is to make sure that I have vegetables on my plate for lunch and dinner. Usually half my plate is vegetables. So, and a lot of that is pre-planned because if I am waiting until the moment of eating, I'm not going to make the best choices. So what I am eating has already been decided probably days to a week earlier. I already know. So I figured that out for myself. And then, like I said, I got my trainer, which was very helpful. I have my water, literally my water bottle sits, it's right, I can look at it. It's in hands distance. So I made drinking water super easy for me. I started, because I know your microbiome is very important. So I started taking probiotics and having different things like that in my system. And so I was definitely able to lose the extra weight I gained. And so now my weight this morning, I think I was like 175. So this is the lowest weight I've been in a very long time.
Wow. First of all, just to mention what your weight actually is on camera is awesome. So yeah, I love your journey, because you talked about some things that went well, some things that didn't go well, and how you would say, let's realize to yourself, okay, this is may not be the best time for me to try to push it more, but you maintained where you were, right? So you're like, okay, if I do this, and you didn't make it super complicated, because that's what people try to do. They're like, oh gosh, what do I do? It's so many different things to try. And you're like, add a vegetable, add a vegetable. I mean, that was key there. And then you talked about too, that after you got to a certain point and you wanted to go to the next level, you added someone in on your health journey, a personal trainer. So I think that's key also, that we can go a certain distance on our own, but when we want to move it to the next level, we definitely have to add in someone else that can push us a little bit more, to help us, say, okay, yes, you can do this, but you probably can do a bit more, right? If you really are honest with yourself. So I love that. So when you got into your relationship, you're like, okay, you got little lax, and then you're like, oh, wait a minute, what's going on? So was it besides like the number on the scale that tipped that in your head, or was it just the way that you looked, the way you felt? Like, what was it that you can like tell us, like, if there was a certain point that you're like, okay, there's something that's not right, and if I want to continue on my own journey, that I need to change?
So many parts of that. One, my clothes were fitting different. I always wear dresses, so dresses are so forgiving. Like honestly, even some of the dresses I wore at 230 something, I'll wear today at 170. So it's kind of hard to tell. I was able to actually, I was kind of working a little bit with the trainer, but not really. And I saw myself in the pictures because she took pictures all the time, and I'm like, this I don't like. I don't like it, but I know my body could look different. I don't feel like I'm at the place where I want to be. And then I also saw that I wasn't doing the things that I know was right for me. I was eating out all the time. Like I hadn't seen a vegetable in multiple days. I'm drinking lots of juice, which I know is like when I tell you I don't drink juice at all, really, other than I pretty much just drink water all day. When I saw that I really wasn't drinking water, when I saw that those foundational things that I know work well for me that I wasn't doing, that's when I knew, okay, I need to get it back in gear. And I knew I had to separate how I ate from how, well, now he's my husband, how my husband eats. Because I really tried like eating how he ate, because like, oh, we're going to eat together. And no, we have different patterns, we have different bodies, and there's nothing wrong with it. We just have different needs. So sometimes we just don't eat together, or I'll be eating and then he's eating, and it's just different because he eats later. I know I can't really eat late at night because it just doesn't digest well for me. I'm more like, he calls me old because my dinner is at like 4:35. And I love it. It feels good for me to eat that early, but he does not like that. And that's okay. So, but I had to learn that because I was trying to eat later on, and that wasn't doing good for my body.
Yeah.
So it was kind of untying myself a little bit from the nutritional kind of standpoint, but still staying connected. And that was a lesson I had to learn for myself. And that's kind of just one of those journeys you have to go through.
Yes. That's good, because that's like the same for me and my husband. Like, we try to eat together, but that doesn't usually work. Like I usually like eat early too, like between 5:30 and 6, like after I'm home from work, because like you said, you want it to digest before you go to bed. And you said something key to, like separating your own journey from someone else's, that whether it's your spouse or a friend, family member, anyone else that's not going to be exactly like you, that you can't do exactly like them. So they can give you some tips and tricks, but like you said, you have to go through it and see what works well for your body. So we talked about the physical things that changed and what was going on. What can you tell us was going on in your mind during these times, like grad school through now? Like, what were those mind shifts that you went through to come to your own journey?
A lot of it was letting go of what is perfect. Because when you're on a diet, everyone's like, oh, you should be eating salads. No, 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 no. I'm going to eat what I'm going to eat because this is where I am. I would love to be like, well, not really, but some people say, oh, we're all vegan and blah, blah. I, at certain points in my journey, I wasn't there. That wasn't a sustainable thing for me. I could add in, and I love some of those components, but it wasn't a sustainable thing for me. Now I'm moving more towards being more vegetarian, and I really feel like I'm in the end going to be probably plant-based, with an occasional chicken like once a week. That's considered plant-based, but that's me.
It's
And
plant
that was another
predominant, so that's good.
predominant. And I think that was another shift. I kept trying to fit into, well, I need to be this diet or that diet or this diet or that. It was more of taking the essence of what that diet was and how it fit best with what I'm doing. I knew that I could not drink a lot of juice. I knew that I couldn't have a lot of chips because that's a trigger food. Another thought shift was identifying how I felt when I ate certain things. And did I have control over those foods when I ate it? I don't have chips in my house because I don't have, even to this day, I still don't have control over that. So that was a big shift for me, is just kind of decreasing the access to certain things.
Yeah.
Other mind shifts were the planning. Before, never was a planner. But now I try to sit down either at the beginning of the week or whenever to say, okay, this is what I want to do eating wise. Whether it's sometimes we were able to connect with one of the local chefs here. Being me and my husband, were able to connect with a local chef here. So he's able to prepare some of our food. So it's planning from that standpoint. Or if I'm on my own, having to use my own skills, like what is my food going to look like, and planning that way. Or another thing I would go to is like restaurants and get like big family meals and planning from that standpoint. So it's really just making those decisions ahead of time versus making it like, okay, it's breakfast time. What do I want for breakfast? No, I already know these are my options. I'm going to have this, this, or this. Choose one.
Yes, yes.
And that just made my life a lot easier. And then also figuring out what happens when I am stressed, or what happens when I have like a bad day. Do I just restrict the next day, or can I just go back on my journey that I was already on? And I chose to just go back on my journey that I'm already on, because I saw when I tried restricting and all that, it ended up being this restricting, and I didn't like that cycle. So if I had some time when, like, I was just in Jamaica and we were at all inclusive and we were eating, doing all these things. I actually lost weight on the trip, which I was shocked about.
Wow.
But when I came home, I said, okay, let's just get back to doing what I was doing before. There's no new plan or anything like that. It was, I'm just going to get back to eating how I ate before.
Yeah. And that's good too, because like when it's actually a lifestyle, whether you're on vacation or anywhere else, like you it's like almost programmed in you that even though you may not do exactly what you do at home, it's still some part to that that's with you. And so that's probably why you still lost weight. You probably were still, even more active. You probably ate a few things that you wouldn't normally do, but you probably didn't eat a whole ton. Like I said, your body just knows, and you're like, okay, I'm done. I'm going to cut it off. So that's pretty awesome. I'm loving your story here. Like, it's just so many things. So one thing I want to pull out from you is that you talk about, what do you do when you're stressed? Because I would talk about this too, that there was days before where I would call my sister, like, it's a Coca-Cola type of day, because people know that I was a Coke-aholic. You mean somebody that had Coke? I mean, I would track the cycles that the Coke went on sale, and I would stack and stock up. So that was my vice. I could say now I am probably, how many years? 4 years Coca-Cola free, and keep going. So what, talk to us a little bit more about what you do during those stressful times. So like, say it was a long day at the office, or, something went wrong at home or something. How do you keep yourself from just what people say, just completely falling off the wagon and going back to your old habits?
Okay. So there's a couple layers to that. One, I created a joy list. So
Nice.
I literally made a list of things that make me happy. And I
Love
try to
that.
incorporate those things that make me happy in my day. So it is simple. Like, I like listening to music. So I'm listening to music all the time. Talking to my sister, because she is hilarious.
Mhm,
Listening to podcasts make me happy. Looking at nature type things. In one of my previous offices, there were trees and there was like rivers. So just like being out in nature made me happy. Going to Zumba class, of course. Joy.
mhm.
Yoga, meditation. So I made a list of like 10 things that are like my go-to, and I just already spread that out in my calendar. Those were already scheduled or just incorporated into how I live my life, because I already know, as a physician, as an entrepreneur, as a new wife, as just a woman living in
Mhm,
America, stress is going to happen.
mhm,
So let me go ahead and add some joyful things to my experience so that I'm not already dealing with a stressful thing and not having something that is going to light me up, just
mhm.
include it in my life experience. So that was number one. I already scheduled the joy. It's scheduled. But
Schedule the
then when the
joy.
stress, yes,
Mhm,
when the stressful thing does happen, and it does, I try to kind of use all the skills that I have. One, I'm listening to my thoughts all the time. So that's when the meditation was very helpful for me, because it helped me to slow down enough to start to hear the thousands. I don't know how many thoughts we have in a day, but I'm sure for me, it's probably millions. But I think it's more thousands for people. But it helped me to start to listen to those thoughts that I was having and to actually stop and think new ones. So even today, I was running around trying to get some things. I'm like, oh, this is gonna be a disaster. I'm not gonna have a camera. No, I'm speaking to myself, which maybe someone will say I'm crazy, but I don't care.
I
I'm
do the
like,
same.
no, I am gonna be okay. You're gonna get this camera. You're gonna plug it in. You're gonna be fine. And like really trying to introduce some of those new thoughts, because a lot of times stress is more to do with how we're reacting to certain situations and those thoughts.
Mhm,
So I just try to become, and I'm not a master of my thoughts, but I'm just recognizing where those thoughts are and being okay with it.
mhm.
And a lot of times when things are happening, I'm like, this stressful thing's happening, and I'm okay.
Yes.
Insert whatever stressful thing it is, and I'm okay. And it's really me breathing in to remind myself in that moment, even though this whatever terrible thing is happening,
Mhm,
I'm okay. I'm okay.
mhm,
And it's just reminding myself of that. I do that all the time.
mhm.
I'm constantly reminding myself, you're okay. Yep, it's okay. Yep. That person annoyed you?
It's
Yep,
okay.
but I'm okay. It's
Mhm.
always going back to, but I'm okay. It's okay. The situation is okay. It'll be handled. I'm all right.
Yes, yes. That's so good. That's so good. I had to write that down. Schedule your joy. Like that was spoke powerful to me, because like sometimes we wait and say, oh well, I'll celebrate and do things down the road. But no, if you do that every day, that would definitely decrease your stress level. So I'm going to steal that from you, Dr. Brew. I'll tell people the first time I heard it from you, and then like my pastor said, after the third time, it's mine.
You can take it. I'm totally fine with it. I want everyone to schedule joy. It'll make everyone's life better, and they will live in a better world. So take it.
Yes, yes, yes. All right. So again, loving your journey. And one thing I wanted to bring out, because I saw that you posted on social media, and you mentioned a little bit here that you are becoming a yoga teacher. So you talked about how you love Zumba. So how did yoga come about in your journey?
Oh my goodness. That was so I've been able to really kind of listen to myself and my intuition and my voice, and that's where the yoga came from.
Mhm,
I really, with seeing so many patients with obesity medicine, I probably had hundreds, if not thousands, of encounters with people. One of the major things that I've seen is one, people's level of stress, two, their disconnection from themselves and their body, and a desire to just be flexible in their experience and their body in so many different ways. And I just kept like yoga just kept popping up. And I've done yoga in the past. Am I like was I a yogi before? No, I would never call myself that. But now I have this kind of time off to really focus in on myself. But I'm like, you know what? Something in me says, I need to be a yoga teacher. I need to just learn these skills. So I signed up for this wonderful class. It's 5 weeks in St. Augustine, it's like an hour from where I live. And I've been doing it for 2 weeks now. And it's been probably one of the best experiences of my life. Nice. We're doing yoga every day for probably 3 to 4, if not longer hours, just learning about the science of it. And all the things I said before is like times 10. And I plan on creating all these different experiences to help people. And I think bringing in those aspects of yoga will do so much to help with being able to cope with stress, being able to really learn about your body, because when you get in tune with what your body needs, it's very easy to make choices about even eating, because you can then start to sense, when I eat this food, I feel this way. But if you're disconnected from your body, you don't even feel the difference when you're eating a cake versus eating greens or eating a salad. So it really starts to get you back connected with your body and your senses. So it has been wonderful. I'm so excited about it. I'm just excited about how my own body has changed. Yes. My own sense of well-being has changed in the past couple of weeks. So yeah, it's been this surprise blessing that I didn't know that was that, but I'm glad that I just listened to it and said, oh, well, let's just try it and do it and see what happens.
Right. I love it. I love it. Being so open. So yeah. you told us so many wonderful things on today. Can you pick out, like, if you had, like, what do they say, that elevator moment, like you're waiting for the elevator to come and you had someone just like, oh, I've been having trouble losing weight. What can I do? What would be like 2 things you would tell them before the elevator comes and you have to get on and move on?
I will tell people to create food foundations, meaning these are the things that I know work for me. And you can get guidance from different diet plans, but have simple food foundations. Like for me, I just try to make sure I have half my plate vegetables, lunch and dinner. And if I can include some vegetables for breakfast, fabulous. I make sure I have water with me at all times, so I can drink at least 64 ounces a day. I move my body every day, whether that's walking, Zumba, yoga, whatever. And I make sure I go to sleep. My goal is to sleep at least 7 hours a night. So it is having that foundation. So when you get thrown off, when something happens, when whatever, you can go back to that.
Excellent. So strong foundation. So that's what we need. So you need to make sure you have that. And I'm going to throw in there, add that, schedule your joy. I like that. That's going to be my thing. Schedule your joy. All right, Dr. Tanielle, can you tell people where they can find you if they want to find out more about what you have upcoming in your obesity medicine practice from here?
Yes. So actually, everyone just follow me on Instagram, Coach Brew-MD. It's spelled COACH, Brew, BREWMD on Instagram. All my new offerings as they're being developed will all be displayed on there. When I build a website, it'll all be displayed on there. So first stop, go to Coach Brew-MD on Instagram.
Wonderful. And I will definitely put that in the comments so people can find you. So thank you so much for agreeing to come on. I knew that you were going to have some great information for us and you did not disappoint. So thank you so much. I appreciate you.
Thank you so much for having me here.
Yes, ma'am. All right.